Shri P.P. Chaudhary ji, Honorable Minister of State for Cooperative Affairs and Law, Justice, Government of India. Shri Gajendra Singh ji, Honorable Minister of State for Agriculture, Government of India. My esteemed colleague, Shri Narayan Chand Pancharia ji, Honorable MP, Rajya Sabha from Rajasthan. Shri Ram Narayan Dudi ji, Honorable MP from Rajasthan. The President of All India Institute of Medical Sciences, Jodhpur, Dr. S.C. Sharma ji. Dr. Sanjeev Mishra, the Director of All India Institute of Medical Sciences, Jodhpur. Dr. Kuldeep Singh, Dean Academics, AIIMS Jodhpur. Esteemed faculty members, graduating students, ladies and gentlemen, it is a matter of great honor and a moment of pride for me to preside over the historic event of first convocation of All India Institute of Medical Sciences, Jodhpur. I congratulate all the students of first batch of MBBS and BSc Nursing who are receiving their academic degrees and and awards today. The Convocation Day marks an important day in your life and a significant milestone in career progression. By your hard work and dedication to maintain high standards, you earn your degrees and awards. It is a moment of pride for you as much as it is for your teachers, for your parents, and all those who have contributed in shaping your life so far. The high order of professional skills and ethics that you imbibed at AIIMS Jodhpur, I am sure that you would always be a part and parcel of, it will be always a part and parcel of your lives. It is heartening to know that the All India Institute of Medical Sciences Jodhpur has been developing at a rapid pace. The academic activities of All India Institute of Medical Sciences Jodhpur has now increased manyfold, with nearly 1,000 students pursuing MBBS, MD, MS, DM, MCH, BSc Nursing, MSc Nursing, and Fellowship, etc. All India Institute of Medical Sciences Jodhpur has started School of Public Health that has an important function to prepare the workforce for the community and the nation. The research of AIIMS Jodhpur is developing, and it is indeed a pleasure to know that the institute has been selected as the DBT Center for Genetics and DHR ICMR regional level viral research and diagnostic laboratory. I am glad to know that the hospital services are also improving day by day. Super specialties like neurosurgery, neurology, burns and plastic surgery, surgical oncology, surgical gastroenterology, specialties including trauma and emergency are being provided. With the establishment of super specialty services, AIIMS Jodhpur has been helping people of the region in getting treatment in the vicinity itself, something for which patients had to travel to Jaipur, Ahmedabad and AIIMS Delhi and other parts of the country. Inauguration of auditorium, Ayush building, radiology block, oncology, emergency and trauma blocks will further enhance the capacity of AIIMS Jodhpur. We have also laid foundation stone for the construction of 100 type 5 quarters, boys and girls hostels with capacity of 300 students each and central animal house. Ensuring the highest standards of medical education is the top priority of our government. We have now planned for rapid expansion of the medical education in the country. Government of India has taken many initiatives in the field of medical education since 2014, which include introduction of National Eligibility and Come Entrance Test NEET, along with common counseling to do away with multiple entrance exams and ensure transparency. Malpractices of capitation fees has come down drastically, and meritorious students are getting more chances, which will lead to the better standards of medical education. Since 2014-15, undergraduate and postgraduate students' seats have increased by 18,000 and 13,000 respectively, and the number of UG, PG seats in the country has gone up to 70,000 and 45,000. 118 new medical colleges have been added in the last 5 years, raising the total to 499 medical colleges, which is the highest in the world, which is 70,412 seats. Existing medical colleges are being upgraded by setting up of super specialty blocks in 70 such medical colleges in the entire country. We are expanding the network of our medical colleges in a big way by upgrading 82 district and referral hospitals to medical college all over the country to remove the regional imbalance. The DNB qualification has been made equivalent to MD and MS with few conditions. Under the inspirational leadership of Honorable Prime Minister Shri Narendra Modi ji, 14 new All India Institute of Medical Sciences have been announced, and classes have already commenced in 8 AIIMS during the period of last 4.5 years. We have undertaken a number of initiatives to improve quality of services in AIIMS. To address the issue of shortage of faculty in the new AIIMS, the system of walk-in campus interviews has been introduced with a view to catch the bright young passing PG students from All India Institute of Medical Sciences and AIIMS before they are lost in the private sector. Friends, here I would like to say that as a new initiative, we have decided that a student who is interviewed will not wait for the selection committee to be approved by the IB and GB. He will be selected by the selection committee, and approval will be given later on, so that he gets the opportunity to serve the All Indians of Medical Sciences. And here I would also like to request that you should also see to it. There was a time in 1960s and 70s and 80s when there was only one All Indians of Medical Sciences, an institute of excellence. But today, 14 new All India Institute of Medical Sciences are coming up. It is an opportunity, and I want that all AIIMS students should be recruited as faculty members in All India Institute of Medical Sciences, 14 institutions which are coming up. But it should be your also first priority to see to it that you go for All India Institute of Medical Sciences. We are trying to bring an AIIMS culture. We are trying to see to it that Delhi AIIMS faculty comes to Jodhpur. Jodhpur AIIMS faculty goes to Delhi All India Institute of Medical Sciences, works there for 3 weeks, 4 weeks, understand the working culture, and see to it what we call as the brand name of All India Institute of Medical Sciences. That should be Pan-India All India Institute of Medical Sciences brand. That is what we are trying to work. We have introduced innovation in the governance of new AIIMS with the constitution of Central Institute Body as the overarching governance structure for the governance of All India Institute of Medical Sciences to address the issues and problems of governance of large number of AIIMS. The CIB will take decisions on common policy matters of All India Institute of Medical Sciences. Now, since now we have got in total 23 All India Institute of Medical Sciences coming up. So, as a policy matter, there should be uniformity as far as the All India Institute of Medical Sciences is concerned. So we have changed the administrative structure. Now we have got the Central IB, Central Institute Body, which is chaired by me. And all policy matters, may it be Jodhpur, may it be Bhubaneswar, may it be Guwahati, may it be Kolkata, may it be Kalyani, all policy matters will have uniformity so that the AIIMS culture grow all together in the same spirit. One major area of concern in new AIIMS has been the shortage of faculty and non-faculty human resources. The Central Institute Body is working, devising ways for common recruitment at all levels to cut down delays in the recruitment process. This will provide impetus to the process of filling of the vacancies. The new institutes will only be as good as their people organizational culture. As the new AIIMS are getting established, the focus of the ministry has been to create AIIMS-like culture and excellence. AIIMS Delhi and Niti Aayog are taking a lead to create right systems and right work environment in All India Institute of Medical Sciences. As another significant step forward in the direction of reforms in governance of All India Institute of Medical Sciences, we have appointed eminent persons from the field of medicine as President of Institute Bodies of the 9 All India Institute of Medical Sciences. Here we have Professor S.C. Sharma as the President of All India Institute of Medical Sciences, a very celebrated and very leader in the health sector, who is your All India Institute of Medical Sciences leader. The overarching governance structure in the form of Central Institute Body, coupled with appointment of presidents and IBs, would meet in twin objective of decentralization of local institute level governance for speedier decisions while ensuring uniformity in the major policy directions across the AIIMS. Friends, when I'm talking about AIIMS, I would also like to talk to you about the changes which have taken place in health policy in the past 4 years. How governance can bring a change, that is also we have to understand. Since long we had a very old policy of 2002 of health policy. We have come out with a new health policy which is known as Health Policy of 2017. The main feature of this 2017 health policy is, previously the whole policy was subjected to disease specific. When there was a disease, there used to be a program. When there was smallpox, a smallpox eradication program. When there was chickenpox, there was a chickenpox eradication program. When we had tuberculosis, we started a national tuberculosis control program. When we could not control, we started a revised national tuberculosis control program. Then we faced the HIV, AIDS. So all our policy and all our budget system was disease specific. Although we have been able to curtail to a larger extent as far as the communicable diseases are concerned, but now the real challenge lies with the non-communicable diseases. So keeping this factor in view, the new health policy enunciates, and here, because you are the leaders of the health sector and you are going to take charge tomorrow of the country's health, you should understand how we are bringing changes in it. We have changed from disease-specific to preventive, promotive, curative health care and a holistic health care, which is now some of the substance of the health policy. You will be happy to note that in AIIMS Bharat, we are converting 150,000 sub-centers and PSCs into wellness centers. This year we are going to convert 15,000. Last year we converted 5,000. Next year we are going to convert 20,000. Next year we are going to convert 40,000. And by 2022, when we aspire for New India, it will be all 150,000 sub-centers converted into health and wellness centers with a universal screening of every individual at the age of 30 for hypertension, for diabetes, for tuberculosis, for leprosy, for cervix cancer for ladies, for breast cancer for ladies, for oral cancer for both, and palliative health care, mental health care and dental health care. So at the age of 30, we'll screen every individual of the country so that we are able to reduce the disease burden in coming time. This is the new health policy which enunciates, and this is how we are working. And also, when I said preventive, promotive, we are also going for curative. And when I talk about curative, I talk about the AIIMS Bharat. It is the world's largest health coverage scheme. And here I want, because now All India Institute of Medical Sciences Jodhpur is also involved in the AIIMS Bharat. People coming from outside, of course, the Rajasthan has not joined us yet, but people coming from outside are taking the support and they are getting the coverage of 5 lakh for diseases, and the range is 1357 types of packages are there. So this is how we are working, and we need your support. And I would also like to share with you that only 115 days have passed since this program has been launched, and more than 9 lakh beneficiaries have taken help of this program, and more than 11,000 crores, 1,100 crores have been spent on the people for this program of AIIMS Bharat. This is how we are working. So we need your support in this also. The AIIMS Bharat Yojana, which epitomizes political commitment, vision and guidance of our Honorable Prime Minister, is already being hailed globally and the paradigm shift of healthcare delivery. Under AIIMS Bharat, comprehensive healthcare through health and wellness centers with effective referral linkages and Pradhan Mantri Jan Arogya Yojana for affording finance and protection to the poor for the secondary and tertiary care hospitalization are the twin pillars envisioned to take our country on the path of universal health coverage. These two far-reaching initiatives under AIIMS Bharat will build up the new India by 2022. It is a holistic scheme that covers all dimensions of healthcare, namely prevention healthcare, promotion healthcare, primary healthcare, and as I talked about the wellness centers, transforming existing sub-centers and primary health centers to deliver comprehensive primary healthcare. Honorable Prime Minister Shri Narendra Modi ji, as I told you, on 23rd of September, he started this program and it has been a huge success. I would like to share with you at this point of time that a lot of discussion kept on going on that which pathy has to do what. This we don't recognize, this we recognize. The new health policy also talks about mainstreaming of all pathies together. And that is why all Indians of medical sciences has got an AIUSH block. That means co-sharing and co-reference. Even references will be given to other pathies also, and co-sharing of the institution will be done. And we have started a Center for Integrated Medicine in New Delhi, AIIMS, where we are trying to project and see to it that how Ayurveda can also help with modern medicine, how homeopathy can also help with modern medicine, how Siddha can also help, and how yoga can help. And all we are going to do is to see to it that it should be documented, proved, and accordingly done, so that in a scientific manner we make all pathies as a mainstreaming of all pathies. This is also one initiative which we have taken. Friends, students, young doctors and faculty, I invite you all to join the Ministry of Health and Family Welfare in further building upon this commitment of our Prime Minister to upgrade the healthcare access of the common man, thus taking the well-being of our nation to ever greater heights. I am sure the students who has been conferred with the degrees in the first convocation of AIIMS Jodhpur make their name in the field of medical sciences and make the institute proud. Provision of quality health care plays the most important role in the all-round development, progress and prosperity of the country. You, the graduating medical students, have a crucial role to play in this. You have to do this with the utmost devotion, care and compassion. Today is not the end of the course of the studies, but the beginning of the road ahead. Friends, here I would also like to suggest you or just share with you. You have got your awards, you have got your degrees. It's a very precious, your lifetime achievement, you have got it. But my experience in life says that any person or any individual is too small to reward or award anybody. It is the personal satisfaction through self-introspection that we have to understand whether we are satisfied with our work or not. That is the greatest award which you have to understand. So, understanding the importance of degrees, understanding the importance of the certificates, always be vigilant and self-introspecting whether you yourself is satisfied with your work or not. What type of improvement you need to serve the humanity. How you can become more and more meaningful. How you can be more contributing. You see, everybody works for 12 hours. But we have to evaluate how much quality contribution has been done in those 12 hours. That is the beauty of oneself. And when you start self-introspecting, you will understand, and that will be your best performance, and that will be the best satisfaction which one can get, and that is the best contribution which one can give to the society. So friends, in the end, to conclude, I once again congratulate all the students who have received the degrees in the first convocation ceremony. I am sure you will be the leaders in your areas where you work and help to build the healthcare system of India as one of the best in the world. Thank you very much for giving me a patient hearing.